My name is Roland. Professionally, I've been trained as a lawyer, and I spent 20 years as primarily a criminal defense attorney. I was in court virtually all day, every day, and literally I've handled tens of thousands of cases, and maybe even hundreds of thousands, I'm not sure. It was not unusual for me to deal with 100 separate court appearances in one 3-hour morning session in court. I did that for 20 years. Also, for 2 separate periods of time, I've represented professional athletes in pro football and in pro basketball. I am still working as a lawyer. The accident put me out of commission work-wise for a considerable period of time. I was able to come back and function, albeit at what I knew was a lower level of efficiency. I could feel that my brains were still there and my abilities were still there, and yet I felt as if I was having to sort of put out more effort to get the same result, if that makes any sense to anyone. I came to Dr. Jowdy after a seemingly endless series of consultations and treatments by many other doctors of various sorts, in addition to other healing arts. And all this came about as a result of an accident I had while on vacation. I was with a tour group, and they rented bicycles for us and gave us each a bicycle, and we set about going around the circumference of an island. At a certain point, the leader had 3 of us go ahead. What he didn't tell us was that there was going to be a very steep descent and this very, very winding descent right around the corner. When that happened, at a certain point in time, my speed was such that I felt I should hit the brakes. The problem was, when I hit the brakes, there were no brakes. I careened down the hill, doing my absolute best to stay aboard that bike to the bottom of the hill. Of course, I didn't know where that was. And at a certain point in time, I knew that I wasn't going to make it. The last thing I remember is seeing a little ditch to my right. I knew I was going to crash, and then splat. I was on my back. My whole body was buzzing as if someone had shot a massive jolt of electricity through it. And then I realized that I couldn't move anything but the very tips of my fingers and the very tips of my toes. There's a long story behind how I managed to get back to the United States after emergency surgery in Hanoi. But I think what I would prefer to talk about right now is what's happened since I've come to see Dr. Jowdy. And that is, I came here with seemingly endless pain, which ranged from a level of tolerable to a level that would make me basically want to sit on my bed all day and spend all my energy just trying to control the pain. Quality of life was varied from tolerable to virtually non-existent, and I really couldn't gather enough energy to do anything. I really couldn't enjoy anything. I had nothing left by way of initiative or spark or anything of that sort, because so much of my existence was devoted to managing the pain. Now, having seen Dr. Jowdy for 5 treatment days at this point, I can tell you that whereas I came to him with what I would call a dump truck full of vitamins and supplements, I am now not taking any of those because they really don't address the issues that needed to be addressed. Instead, I've been working with Dr. Jowdy, and he's done various procedures on me, non-invasive procedures, which have addressed, among other things, foremost my pain, which, as I say, initially ranged from barely tolerable to virtually intolerable. And at this point in time, I've not only eliminated the supplements and the vitamins, but I have reduced the amount of prescription drugs that I had been given and have been taking for the past 6+ years. Now, one of the major things we've worked on is regaining some stability in a standing position and in moving with stability in a walking position, something which I knew from the moment I relearned to walk after my accident was going to be an issue. My balance, I realized, was off post-accident and had remained off until I got to Dr. Jowdy. We've worked extensively on that, and I feel much more stable standing and walking than I have since my accident. And also, proof is in the fact that scientifically my stability has been measured, and the improvement I've seen on a daily, perhaps even on a 5-minute to 5-minute basis, has been just very steady and constant. The second thing about stability is that my gait and all the components of gait, my leg movement, foot movement, my arms, even my trunk, Dr. Jowdy's worked with me on those to regain natural form when walking. That's really helped me to the point where I feel as if I have regained the sense of steadiness that I used to have, that I used to take for granted. And that's something I won't ever take for granted again, I can tell you that right now. We're continuing to work on other issues. He has identified several what he's called neuropathies, basically that I have polyneuropathy as a result of my accident, among other things. And the source of that appears to be in large part due to a cyst-like looking object that appears to be residual from either the accident or the surgery subsequent to the accident. And this object is in my spinal cord. It's actually a little obstruction looking thing that one could see on an MRI, and in fact I have seen it on an MRI film. We're working at ways of essentially working around that cyst-like object so as to recreate a normal nervous system and recreate pathways from the brain to other parts of my body. Because of the location of this cyst-like object in my neck, everything from my neck downward has been affected by this accident. So that would include all 4 of my limbs and my trunk. And when I speak of pain, the pain covered every area of me from the neck down. And when I speak of lack of balance, everything from the neck down was affected by the accident, and that, of course, made it impossible for me to have balance. And my ability to walk, as has been pointed out to me, I looked as if I were Frankenstein or maybe one of his distant relatives when walking post-accident. And now I'm rapidly approaching the feeling, subjectively and objectively, the observations of someone from the outside, that I'm actually back to walking in a normal method. That I think covers most of what we've done to date. However, there are many other applications that Dr. Jowdy has done, for which there are multiple results, and sometimes he does something which is intended to primarily intended to affect one area, but there always seems to be a tie-in to other areas, because in so much of what is going on here, we're talking about systems, not single A leads to B leads to C type chains of command within the body. The body is much more multivariable, multifunctional, integrated, interrelated than we previously perhaps had been led to believe, or we previously perhaps have thought, conceived of it as. And I think that's something that is important for people to know. Our body is one large system, and within that system are many subsystems, and the subsystems all are interrelated, each to the other, and without the interrelations, you have a lot of independent little things running around which really don't coordinate with each other. And that is what large part of what happened to me. Some of my systems, my subsystems, went haywire. Others maybe didn't, but the interconnections between subsystems also went haywire. So has been an issue not only of correcting or remapping individual subsystems, but also correcting or remapping the interconnections between all those individual subsystems, so that you actually have a complete and unified whole, that you're actually back to being a whole human being. Subsequent to my accident, I've seen probably 30 or more health professionals running the gamut from allopathic doctors to chiropractors to naturopaths to masseuses to physical therapists to acupuncturists to acupressurists to I can't even think of how the variety of people I've seen, and they've just accumulated over time. The list seems endless, but I know there is a finite number. It's just that at this point in time, it's hard for me to even keep track. Now, as far as the diagnosis, when I was initially brought from the accident scene to a hospital in Hanoi, I was diagnosed with swelling of the spinal cord, and in order to relieve that swelling, emergency surgery had to be performed, and they did a C456 laminectomy, opened up the dura mater surrounding my spine, relieved the pressure by slitting that dura mater and patching it, and then closed me up again. Their subsequent MRIs showed that there still remained a cyst-like looking area, either from the accident or from the surgery, which to this day exists and is in significant part a focus of what we're doing here at Dr. Jowdy's, in that we are building workarounds, essentially alternative pathways to solve some of the problems created as a result of this accident. In terms of the actual terms, traumatic brain injury, it's interesting. The awareness of that, the recognition of that diagnosis was not easily forthcoming. It seemed that a lot of the medical community or the health professional community looked upon me as someone who needed to have surgery, and once surgery was done, I was going to be just fine without regard for any other consequences. Unfortunately, it seems that what they forgot was that the body is a system composed of subsystems, and many of my subsystems had been knocked askew or knocked out of commission, and as a result, I was operating, almost working against myself a lot of the time, and it caused me to expend a tremendous amount of energy just trying to exist in life as opposed to actually living life. It's many days I've spent just trying to get from that day to the next day. That was my only goal in life, just to get from one day to the next. So great was the level of pain, and or so great was the drawdown on my energy just to try to control the pain and or move. Although some health professionals averred to the fact that I had a traumatic brain injury, or I perhaps had a traumatic brain injury, it really was only Dr. Jowdy who concluded that definitively, and that was after he had examined reams of MRIs and CT scans and X-rays that I myself had accumulated since this injury, in addition to lots and lots of medical records and statements, historical statements from me, chronological statements of the injury and what has succeeded that injury. One of the unique things about Dr. Jowdy's treatment is the fact that before he will treat you, he absolutely wants to see everything he can see by way of medical records and films, etc., to get as complete a history and understanding of one's situation as he possibly can. In my case, because I'm a fairly good collector of records and films, I brought in a full box that was probably 40 pounds in weight and or more, and I had probably over 100 films, individual large film sheets from MRIs and CT scans, and in addition to that, chronologies from me about the accident and other incidents which could be pertinent to my situation. And my understanding is that all that information that I provided went to Dr. Jowdy, and he told me that before he would be able to treat me, he would need to review everything right down to the last little detail, and organize a plan, a treatment plan unique to me, to optimize my situation. And once he had done that is reviewed everything I gave him and developed a treatment plan, then he was prepared to talk with me about treatment and how to go about it. In this short amount of time that I've been treated by Dr. Jowdy, I've gone from a point of feeling that there were times when the pain was just out of control to feeling that not only is it controllable, but I actually have seen it being controlled. I've been part of it being controlled as Dr. Jowdy has done various applications, various procedures on me, and I've actually felt the pain level go down as a result of a very short in time duration, short application or procedure. One of the other benefits that we've addressed in these first 5 days was the fact that among the many subsystems with which I've had problems as a result of this accident was my digestive system. Initially, post-accident and post-surgery, it basically was afunctional. It didn't work at all. I really couldn't digest much of anything, and it has progressed to the point now where I can actually feel the food that I'm eating actually working its way through my system, something which I really didn't think I would ever have any sense of again, and perhaps something that I really haven't had as good a sense of for many, many years, even before my accident, which seems unusual to me, but it does make sense. And what Dr. Jowdy has explained to me is that he's been working at remapping my organs, certain of my organs, and that to me is his way of saying that he's looking at each organ in my body and working at ways of optimizing its function, working at getting it to be the best it can be, especially ones with which I've got specific problems. He may, on the way to addressing those issues, solve other ones in transit, basically, and that I consider a bonus to the situation. So, you know, I'm lucky to have that little bonus to come with my treatment. I had always considered myself fairly fortunate in that I had always led a very athletic existence. What I didn't realize was that I had injured myself in other ways than broken bones, and I just wasn't aware of what the injuries were, or perhaps more accurately to say, what the fallout from the injuries were or was from each injury. In several cases, I'd had collisions in sports that involved my head, and although I never totally lost consciousness for extended periods of time, I'd had probably 8 or so incidents where I'd had severe blows to the head from one sport or another, and most of them resulted in severe localized swelling of an area of my head, and of course there wasn't much treatment done with respect to that other than icing it and hoping it would go back to where it was to begin with. And what I've come to understand is that many things like that have lasting after effects, and those sorts of accidents should at least be looked into, examined, to see if there have been after effects that could go back perhaps many years. And in my case, my suspicion is that I had some previous athletic accidents that created some after effects that stem from many years ago, and I think that's one of the added benefits of this treatment, is that if those things are present now, Dr. Jowdy will discover or uncover them and address them appropriately. People just used to not really think about that very much, I guess. I mean, I can remember several of the ones I had. I don't think my parents even thought it was necessary to call the doctor, even though,
wow.
Even though, for example, I still have a bump here from when one of the ones I detailed in my list for you was.
You don't feel right after that.
I think I was maybe 8th grade or so, 12, 13 years old.
Yeah.
I was running and I was going to jump over a stone wall.
Yeah.
No problem, except that when I ran and put my takeoff foot down to take off, that foot landed on a flat stone which slipped behind me, so I didn't get the lift,
Right.
and I went headfirst into the stone wall.
Right.
And I ended up with, literally, it was like a golf ball. I mean, it was just, it stuck out so far.
Yeah,
It was
yeah,
like
yeah.
you had a golf ball stuck on my head right here.
Right.
And to this day, there's still
Yeah.
a little bump there.
Sure.
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 And it had gone down. It took years and years and years and years to go
Yeah.
down to where it is now. What happens here? Well, in my case, and I suspect in most, if not all cases, although the treatment is individualized, what happens here is probably generally pretty similar in that Dr. Jowdy has virtually innumerable what he calls applications or treatments, and these applications or treatments are non-invasive in the sense that he is either using himself to do certain manipulations, or he is using sort of what I would call testing instruments to test certain portions of one system or one subsystem. And nothing he does here involves either drugs, being prescribed or fed drugs, or being shot up with anything, or having anything cut off. Basically, it involves a lot of testing using various instruments, some of them very simple, some of them very, very complex and undoubtedly very expensive instruments to examine, test, and chart progress. So what makes Dr. Jowdy different? In my opinion, and from my experience to date, what makes Dr. Jowdy different, among other things, is his singular focus on making you the best you can be. He is not running an assembly line or a repair line for human beings. Each person is a unique individual, and he analyzes each person's case as such. He takes the time and puts in the energy and effort to make sure he puts together the optimal individualized treatment plan, and then he executes that treatment plan. And that treatment plan is very detailed and very lengthy. It involves, as I said earlier, non-invasive modalities and several instruments which help either retrain parts of the body and or brain, and also chart progress from one level to the next as we move through the treatment. What can I say about people who feel like there's no hope, there's no place to go, there's no more chance for me to ever get better? What I can say about that is, from time to time I had those same feelings, and I was not determined to go down without a fight. So I figured if there was anybody out there who would give me a fighting chance, I should give them a fighting chance. And I happened to come across information about Dr. Jowdy, and based upon what I read, I decided, you know what, this guy is open to taking on any person and that person's health issues. And I figured if he was willing to do that, he had to be pretty good, because you've got to be confident to be able to be willing to do that, because you just never know what you're going to get into. And my confidence in him has not diminished since I first came to see him. In fact, it's only increased at this point in time, and I expect it to continue to increase.